WAGS is just an incredible organization, and all of our teams and the dogs that are in there are dedicated to what our purpose is.
Years ago, my grandmother was ill, and I saw how her dog affected her sense of well-being. And so that kind of stuck with me, and we started doing some pet visitation informally, and I saw where that it needed to be more organized to be able to work with more people and be more dependable.
We go to hospitals, we go to nursing homes, we go to schools, and we go to places as hospice with hospice patients, and we'll pretty much go wherever we are invited to go.
We are so fortunate to be in liaison with the WAGS organization. A pet changes the atmosphere. It makes everybody more relaxed, more comfortable, and there's love in the room. You know, pets give unconditional love, and so to have a pet come into a situation that's sometimes stressful, sometimes very sad, just gives a new air to the entire group who's there.
I think it gives a lot of people that are in nursing facilities the ability to reconnect with an animal. Most people at one time in their life have had a dog or had a cat or something of that nature, and sometimes when they get in these facilities, they spend the rest of their life there. And there's not a whole lot of connection with animals. And sometimes we're the only visitors they have.
There are some people that are so sad, and those are the people that I have a hard time getting him away from them. He'll snuggle in and he just wants to stay with them. We also go to a chemo lab, and he sits in patients' laps while they get chemo, and it relaxes them.
You bring a dog in, and the individual will forget about all their problems because they're throwing love onto the dog, and the dog doesn't care about what their problems are.
I think they're very intuitive. I think they sense who needs them the most. She has won over children who are afraid of dogs. She lets the children read to her, and she will act as a pillow for most of them. The other thing we do, and this is particularly inner city children, we like to talk to them a lot about taking care of a dog and the right way to do it.
I work with a patient named Michael Goebel. He's a 12-year-old that had a severe brain injury from getting hit by a car while he was riding his bike. And so he has severe memory and cognitive impairments. And a therapy dog came to see him yesterday, and he got to interact with the dog and pet the dog and give treats and take the dog for a walk. And he really, really enjoyed it. It actually brought back a memory of his own dog, and he remembered that he had a dog. And we were able to talk about that. And then today when I saw him, I asked him, what did we do yesterday? And he said, we played with the dog. So it was the very first time that he's ever remembered something from the day before.
We have a pretty large presence in the area now, but I would like for us to have enough teams to be able to meet all the requests that we actually get. We are a nonprofit, and we are strictly supported by donations and member dues. So it would take funding.
My primary goal is smiles and comfort. Smiles and comfort. I know we can't heal people a lot of times, but we can bring a lot of comfort.